Hello everyone and welcome to week 10. We're just one short week away from finals, but we're finally talking about a subject that I personally love. It's actually one of my favorite topics. As I'm a board certified phlebotomist, I really enjoy teaching phlebotomy. Now don't panic, I know some of you really probably aren't looking forward to this section, but I promise by the end of it you will really love it. So this week we are focusing on just two chapters, Chapter 44, which is the clinical laboratory, and Chapter 47, which is phlebotomy and blood collection. So let's go ahead and dive on in here. We're going to start with Chapter 47, which is focused on phlebotomy and blood collection. Now throughout this video you may hear me say phlebotomy or venipuncture, but know that they mean the same thing. They're just two interchangeable terms. So when you are collecting blood, what you're doing is you're collecting it through a tiny incision in a vein, and that's why we call it phlebotomy. And typically this is done with what we call a hollow needle. Now your role as a medical assistant during this procedure is to make sure that you properly collect, label, and possibly even process or store your specimen. In order to do this, you have to have a basic understanding of your circulatory system, the equipment that we use, the term asepsis, and the venipuncture procedure itself. Now, several weeks ago, back in week 2, we talked about medical asepsis and surgical asepsis. So I'm not going to focus on that chapter or that piece of this chapter. So if you want to, you can review it in your book. Otherwise, you can go back to week 2 and look at what we've got there. So let's go ahead and break these down a little bit more so we can understand them. So let's talk about your circulatory system. Now this system is important to understand because it talks about the heart, blood vessels, and blood itself. Now your heart has one main job, and that's to pump and keep your blood moving. That's it. So it's keeping you alive, but it's also keeping your blood moving. Blood vessels have a job to provide a one-way travel route around your body, then back to your heart. And there are some key players in this process that really are helpful. Those are your arteries, capillaries, and veins. Arteries are what we use when the blood leaves the heart. Arteries have a thick and elastic walls, which make them feel very hard on the outside. And the blood that is carried by them is bright red. Arteries also have a pulse, which makes them very easy to distinguish. Capillaries act as sort of a gas station for your blood. They give your blood fuel, or oxygen, that's delivered to your arterial blood, and the cells, while the garbage, or your carbon dioxide, is removed from those cells and carried to your veins. Then this is where your veins come into play, and they carry the blood back to the heart. So arteries carry it away, veins carry it back. They will first deliver the blood to the lungs, where the carbon dioxide is breathed out and your new oxygen is breathed in. Veins have a very thin wall and they feel very spongy, very bouncy, similar to a trampoline. And the blood that is in those veins is more of a darker red as opposed to a bright red. Now there's your venipuncture equipment. And there's a wide variety of equipment that we use during phlebotomy depending on which one that you are performing. You can use things such as blood collection tubes, double-ended needles, tourniquets, tube holders, and syringes. Blood collection tubes are also called evacuated blood tubes, and they're designed to automatically draw the exact amount of blood needed for testing. Each tube color is coded according to the anticoagulant or additive found within it. They can either be glass or plastic, but plastic is always more preferred as it's safer for not only the medical assistant, but also the patient. Double-ended needles are needles that have a needle on both sides. The tip of a needle is called a bevel, which is the cut at a slant, And remember, when you're doing blood draws, you always want to make sure that the bevel is up towards the sky in order to properly collect a sample. The lumen is the space inside the needle, and most commonly we use what is called a 20 to a 21 gauge needle. Tourniquets are elastic bands used to help collect blood samples. They will be placed about 2 to 3 inches above the puncture site and stay on for only 1 minute. Any longer and it would make the blood sample inaccurate. The tourniquet is placed tight enough so that it stops venous blood flow, but still allows arterial blood flow. Tube holders are plastic devices that are placed at the end of a double-sided needle in order to place on a tube for blood testing. And the last thing we have is a syringe. And these will come in all sizes depending on the size sample that you need. Typically in phlebotomy we use anywhere from a 5 milliliter to a 20 milliliter. Next we're going to talk about the procedure itself. And the procedure can be performed in several areas of the body, but most commonly we will use what we call the antecubital space, or the bend in your elbow. And there are 3 main veins that we use for this procedure. They are the median cubital, cephalic, and basilic. The median cubital is the most popular because it is the largest and the most anchored in your body. It's found directly in the middle of your antecubital space. Your cephalic vein is the second most common that we will use. It's not as large, but it is still well anchored. This can be found on the outer edge or the thumb side of your antecubital space. And your basilic is the last choice option for drawing blood. We don't like to use it for 2 reasons. It isn't well anchored, and it's directly above your brachial artery. So if you go too far, you can nick that artery, which will be very painful for your patient. This vein is located on the inside edge or the pinky side of your antecubital space. Now, we need to talk about the different types of procedures that can take place. You can have a vacuum tube method, butterfly method, or syringe method. Now, the most common method that we're going to have is the evacuated or vacuum tube system. This is the most common because it allows multiple samples to be obtained at the same time without having to do multiple sticks. The vacuum in the tube is set to take the exact amount of sample needed, and then it will stop filling. But not all tubes do need to be filled completely. Most of them can be filled about halfway, and that will be sufficient. The only one that needs to be drawn completely full is going to be your light blue top tube. Next, we have your butterfly method, which is also called a winged infusion method. It is where you have a needle that is attached to tubing, and at the end of the tubing is a syringe or a tube holder for evacuated tube systems. This is used for smaller veins that are difficult to draw on, or children, because then it allows you to have more freedom of movement. Lastly, we have our syringe method, and this method is used to collect samples from small, fragile veins that cannot stand the pressure of the evacuated tube method. The drawback to this method is that the amount that can be drawn for the syringe is limited to your syringe size. Now, let's talk about the order of draw because it's extremely important. The reason is that you want to follow this because you don't want to have what we call cross-contamination between the tubes with the skin or other bacteria or the other additives. Your correct order of draw is yellow tubes or blood culture bottles, light blue tops, red marble or tiger tops, green or gold, light green, lavender, pink, white or royal blue, gray, and dark blue. And you can read more about each of those in your book, but you can also learn more about them in your lab classes this week. Your capillary puncture is the last part of this unit that I want to talk about, and it's also called a skin puncture, and we use this when a very small amount of blood is needed. The appropriate site for an adult will be the middle or ring finger, 3rd or 4th digit on either hand, but preferably the non-dominant. We can also use the earlobe, or for children we use their heels. Now, you only want to go in a recommended depth, which is about 2 millimeters for adults and 1 millimeter for children. You don't want to go directly in the middle of the finger because that can actually cause what we call osteomyelitis, which is an infection of the bone in the finger itself. You'll use what we call a lancet to draw from, as opposed to using a needle, okay? And these are some devices that we use along with the capillary puncture. You can use capillary tubes or microtainer tubes. Capillary tubes are designed to pull blood into the opening of a tube, just as the vacutainer does. They can be glass or plastic. Blue-tipped tubes mean that there is no additive, and a red tip means that they have heparin to prevent clotting. Where microtainer tubes are just smaller versions of your full vacutainer tubes that you used in regular phlebotomy. Now, Chapter 44 is talking about the clinical laboratory and its importance. Clinical laboratories are not only helpful because the physician gets to know the patient, but it also is a way for a physician to screen the patient for diseases, confirm a condition suspected, to rule out a condition, to establish a baseline before medications are administered, to monitor the effectiveness of medication or treatment, and to assess the progress of a disease. And laboratories generally fall into two categories. They're either qualitative or quantitative. Qualitative states that the result is either positive or negative for presence of a specific substance, or quantitative gives a numerical value. So positive, negative could be like a pregnancy test, where quantitative would be like your blood glucose or your hemoglobin levels. It's important to understand that some important regulations. The first and foremost is the amendment that was created in 1988 called CLIA, which is the Clinical Laboratory Improvement Amendment. It was created to protect patients by creating safety policies and procedures, and it addresses the issues of quality control, quality assurance, record keeping, and qualifications of personnel. It establishes standards to ensure test accuracy, reliability, timeliness, and the type of test result. We also deal with OSHA here, but this was something that I'm sure that you've been talking about for many, many weeks now, so I don't really have to go too far into the depth of OSHA. All right, last piece here is talking about quality assurance and quality control. Quality assurance states that the medical assistant is responsible for carrying out procedures that involve planned and systematic activities to ensure that the equipment they're using is accurate and results are going to be accurate as well. Quality assurance will include quality control, orientation, documentation of control logs, maintenance checks, required calibrations of instruments, temperature checks, checking expiration dates on test kits and reagents, and proficiency testing. Quality assurance also developed what we call reference values or normal values. Now, quality control is a part of quality assurance, and it's focused on the physical proof that results are accurate. And this is done through mock testing using calibrations or controlled solutions. Calibrations are specifically prepared test strips or cartridges that are designed to produce a predetermined result, where control solutions are a chemical that produce an expected result that are similar to the testing specimen. All right, guys, that's all I got for you. Here's your homework for the week. You've got one discussion post. It's on the importance of the order of draw. That will be due no later than Tuesday, September 5th by midnight. And you'll have to reply to at least one classmate no later than Saturday, September 9th by midnight. You will have one quiz this week. Again, it's going to be 20 questions long, all multiple choice. And with that, you will have a pretty long time limit as we're getting you prepared for your final exam. That is going to be due September 10th by midnight. That's all I got, guys. Have a great week 10. Bye-bye.